Hi, everybody. This is Cindy Kennedy, and you are listening to another episode of Living with Lyme. Today, we have an expert on mast cell activation syndrome. Is Dr. Tania Dempsey, and she has a practice in New York. We're going to learn a lot about the intricacies of this issue because it does have a big impact on Lyme disease and certainly recovery from Lyme disease. Dr. Dempsey was trained and went to medical school at Johns Hopkins, undergraduate at Cornell. Her practice is called Armonk Integrative Medicine, and it is in Purchase, New York. And she is an expert on treating tick diseases as well as mast cell activation syndrome. And I want to welcome her to the show. Hi, Dr. Dempsey. How are you doing today?
I'm good. How are you?
I'm doing okay. And this is really interesting. Can you give us a little background on you and how you got into tick diseases and mast cell activation?
Yeah, it's been a journey. You know, those of us who treat complex multisystemic disease patients, including Lyme disease, know that it's a process where we start. You know, I started in as a general internist. Actually, that was my general practice. You know, every 10 minutes, seeing patients in and out, and was really not feeling like I was helping people. And I've always had a very integrative approach without knowing that it was integrative. I didn't even know the term. I just always talked to patients about lifestyle and diet and also just how all the pieces connect. And I'm a detective. I love digging and looking at root causes. And there was really no basis for that kind of approach in allopathic traditional medicine. You know, a lot of it is about, okay, treat the symptom, right? And in 2011, I said, you know what, I'm gonna take a risk. It was a big risk then. At that time in 2011, by then most doctors who were internists were joining other practices so that they would lower their overhead and could negotiate with insurance companies. And just when everyone is doing that, and I was part of a large group at that time, I said, all right, I'm going to do it my way. And because I have to treat patients the way they deserve to be treated. And so I started my practice, Armonk Integrative Medicine. It's evolved because as you start to dig, you start to find things that you never thought you'd find before. And if you find those things, you have to research, you have to learn, you have to figure it out, right? And so of course I'm going to wind up in the Lyme disease world because my practice was initially when I opened it right in Armonk, New York, which is really an epicenter for Lyme disease. It's tick country. So inevitably I was going to learn about it and then I was bombarded with it, but then I figured out ways to treat, right? And it's been a process. But what I learned with a lot of these patients is that they weren't getting better. Some patients were not getting better the way I thought they would, or they got better and then they got worse again, right? So I start thinking, what am I missing? Why are these patients who were doing okay all of a sudden not doing okay? And I start looking back at their histories and looking back to see where the missing pieces are. And I discovered mast cell activation syndrome kind of by accident. It's always one patient that you learn from, and I've learned so much from her. She and I did a lot of digging together. We figured out that she had this disease state, but back then, this was probably 6-7 years ago, maybe a little longer, a lot of people were not talking about it. They didn't know about it. So I did all the research. I connected with Dr. Larry Afrin, who is now in my practice with me. He joined me. We have and we just built a new office and center. And he trained me and talked to me. And then I learned more and I teach him and he teaches me, and we have a great setting here. And our goal then is to educate. It's critical that we educate with what we've learned, because we're learning every day. And even though we're considered experts, we still learn from our patients and from doing research, which is really a big focus of what we're doing here at the new center. And then anyway, so here I am today. I will mention that we just changed my name. The office is now called AIM Center for Personalized Medicine, just as an FYI.
Oh, good, good. Well, we don't want people looking at the wrong place.
Right.
How do you spell that?
So it's AIM, it's an acronym, AIM, and then Center for Personalized Medicine. We have a new website coming, but it's best actually right now just to if you're going to Google anyone, Google me, Dr. Tania Dempsey, and drtaniadempsey.com for a website, and then that can direct them into all the different directions that they
Good,
need to
good.
find out more information from.
Right, right. Because certainly you could be a wonderful teaching model, as well as certainly someone that people may reach out to because they need care. And that's one of the biggest problems I found with Lyme disease, is that you'd only get to a certain point and then you'd end up at a dead end, and then you'd find somebody else, and then, like you said, you get better, but then you might get worse. And so explain what is mast cell activation syndrome.
Um, yeah, so let's get down to basics, right?
Yeah, do it. Get it.
So I
Go.
think, yeah,
Yay.
I think it's important for people to know that everybody has mast cells. They are very important in our what we call the innate immune system. That's the primitive immune system. We all have it. We all have them. They are white blood cells that are found in all your organs, in all parts of your body, except the bloodstream. So we always think about white blood cells circulating in our bloodstream, but these are in the organs, in the skin, respiratory tract, GI tract, genital urinary tract, anyway, nervous system. And they're there to protect you from the environment. Okay, they're there to protect you from what's foreign, what it recognizes as potentially harmful to you. Now, again, this is everybody has them. So I want to give an example. If somebody gets a virus, an infection, I mean, we can even say COVID-19, we can say the flu. The mast cells will get activated. That is their job. They're in all the places where they can be in contact with the virus. They're going to get activated. They're going to explode. I like to say the word explode, but it's really called degranulation. They degranulate. They make mast cells make chemicals that they store in these little granules that are ready so that when the mast cell sees something bad and it explodes, it releases these chemicals. These chemicals, some of them are cytokines. There's a lot of talk in the news about COVID and cytokines. Cytokines are really just inflammatory molecules. They cause inflammation wherever they are. So when someone gets sick and they release the mediators, if you could imagine the flu, and the mast cells get activated in the bronchial tubes or in the lungs, right? You start wheezing, you're coughing, you have all these symptoms. Some of this is driven by the mast cell as like the root. And then downstream, you get all these other cells, and they're all in a soup together, okay? So, so in normal people, if you get sick or you get exposed to a foreign thing that the mast cells don't like, they react and then they reset to normal. And they're waiting for the next thing, okay? But in people with mast cell activation syndrome, the mast cells are inappropriately reactive for no good reason sometimes. They are just reset at a different point, and they can't, and sometimes they can't stop. So normally, I think some of this, for a lot of patients, mast cell activation syndrome is a primary issue, meaning they have this as a child. They may not even realize it. They may have some allergies. Allergies are associated with mast cells, and I want to be clear. Mast cells release histamine, right? If you are allergic to something, which is a little different than mast cell activation syndrome, you're allergic to a dog, and you get in contact with a dog, the immune system sees the dog, that tells the mast cell goes boom, histamine, and then all of a sudden you're a running mess, right? So that is one aspect of mast cell function. And so there are people who have just allergy, and there are people who have allergy, or they don't have allergy, they have other things. They have inflammation, or they have other ways that mast cells present themselves. And I think for a lot of people with Lyme disease, and this is why I want to tie it back, for Lyme disease, there are some patients who are born with mast cell activation syndrome, and they kind of putter through life and up and down, up and down. There's little things that happen. They may be sensitive to the environment in different ways. Then they get Lyme disease. And that's the straw that breaks the camel's back. They had this problem they didn't really know about. They get the Lyme, the mast cells completely go crazy, right? And then because of all the treatment that's necessary, because of the persistence of the infection, the mast cells never kind of go back to their baseline. They're now here. And that's why you hear so many patients with Lyme disease who cannot eat. They react to everything. Or they used to take antibiotics, but now they can't take antibiotics. Or they used to take herbs, but now they can't take herbs. And often it's because the mast cells have sort of taken over. And it almost doesn't matter about the infection anymore. The mast cell has a mind of their own. Now, in some cases, though, there are some patients, I have a handful, who really probably did not have anything wrong with them growing up. They were fine, and then they were not fine. They got Lyme, Bartonella, Babesia, whatever, right? Some kind of tick-borne infection, or they were exposed to mold. They had some major trigger, and the mast cells do not like mold. They do not like infections, viruses, bacteria, etc. And so they could be fine. They trigger the mast cell. The mast cell, in a sense, mutates. And now it's become a problem where it really wasn't before.
So is it the immune system can't tell it to go back to its, Rip Van Winkle sleeping mode?
It can't, because the mast cells themselves have their own genetic material. In a sense, they have, all your cells have a nucleus with chromosomes and genetics. And so there's something about the mast cells that get mutated. I'm using the term mutation, but it's actually true. One of the things that Dr. Afrin and I are working on is looking at these mutations and trying to determine if we could narrow down what these mutations are. But the reality is that once that cell has mutated and now it's acting differently, there's not much you can do to reset it just with the body. What our goal is to stabilize the mast cell, eliminate triggers, things that keep setting it off. And what we hope is with time, the mast cell will either reset itself, okay, so the mutation will go away, or the old mast cells that are dysfunctional are going to die. Let's say they live for 2 to 3 years, a mast cell, so then they die, and then a new population comes up, and you hope that the new population is normal.
How do you identify a mast cell activation? I mean, is it just a clinical thing, or is there lab work that can identify it?
Both. I think it's very important that it get identified and that the proper testing is done. But it really starts with the history. So when I speak to patients, I start at the very beginning. I think this should be done in all cases, whether they have this or not. I'm starting at probably the pregnancy of their mother with them. Maybe even the pregnancy of their mother with the other siblings, let's say, before them, okay? Because the health of the mother, exposures of the mother, all those things are important, right? And in modern medicine, it's so interesting that we completely forget about that, right? That baby's not in isolation. It's in a body for 9 months. And so I start there, and then, the birth and the post-birth periods, right? And you start looking at the story, right? And sometimes there really is not much of a story until there's a trigger. Could be Lyme or something.
Crisis, right? The crisis.
But sometimes, yes, crisis. But I have patients who, the mother, for instance, will say to me, the child was born with a rash the minute he came out, right? So already I'm interested. I'm thinking rash. Okay, why? Oh, well, it's interesting. This rash is associated with mast cells. Oh, wow. Okay, so then you start looking through the child's history, through the patient's history, however old they are, and you start to see a flavor. of things like, and I think about it this way, mast cells cause three main manifestations in the body. Okay, lots of manifestations, but three groups. Allergic, and you can have the allergic or not. Inflammatory, and you can have inflammation or not, but often if you have allergy, you also have inflammation. And then a third category called abnormal growth and development. So that is where the body is, the mast cells are inappropriate and they're doing the wrong thing, and they're, you're getting like lumps or cysts. I think about thyroid nodules. I think about ovarian cysts. I think about things that are growing that shouldn't be growing, and the mast cell is involved in that process. And so you can have one or all of those three big groups. And so then once you kind of identify whether they have those things, then you go ahead and you do the testing. And I will tell you, a lot of mast cell patients have my favorite sign on physical exam. If they scratch, they get like a line, right? We call it dermatographism. That tells me they have a lot of histamine. And when you do that, you're actually kind of triggering the mast cells. There are a lot of mast cells in the skin. There are a lot of mast cells in these different organs. And you do that, right? And I go, okay, that's a histamine thing. I'm on alert. And then we do testing, right? And so some tests that you do are simple blood tests. Some tests that you do are more involved, 24-hour urine collections and things like that. But, I know there are going to be people listening and they're going to say, well, how am I going to get that done? And I think that, there are 3 tests that they can ask their doctor to do that I think are fairly easy, are usually covered by insurance. And it's a good start. It doesn't mean that's the end all be all, but if you get your information that way, then you can avoid the more extensive testing that you might need. The 3 tests, if you want to know.
Yep, I'm ready. I'm going to write it down. Let me get my...
You're recording it, right? You'll go back.
Oh, yeah, I guess I could. That's right. Like a webinar.
There you go. Plasma histamine, so histamine level, chromogranin A, and tryptase. And with a good story for this and some markers in the blood, I can then put together a diagnosis. And getting a diagnosis is important. I know there are a lot of people out there who suspect they have something like this because they're very sensitive. They react to a lot of things. They're not getting better. But with a diagnosis, then you open up the options for treatment. If you don't have a diagnosis, you're a little bit limited with some of the basic stuff that we might use for this.
Now, the lab that I usually send my patients to, they only do a serum histamine. Is that of any value at all?
Is it serum histamine? It should work as long as it's not a whole blood histamine.
Yeah, I have to double check. But I know that I've asked them for a plasma and they don't do that. And, it's funny because in Massachusetts, we've been granted independence since the COVID thing as nurse practitioners, but LabCorp's from New York and they're so tight, they're so specific. And so they won't let me have an account with them. So.
Oh, that's unfortunate.
I know. It's tough in New York. They're real strict.
It's
a tough one. So, so you get back these results. Before that, what might the person be experiencing that would make you go, aha, other than the skin dermatographic kind of response?
So you mean in terms of the history?
What would they be saying? You're treating their Lyme, they might have Babesia on top of it. So, you're doing some Mepron or you're doing your herbs for that. And, they're just kind of stuck there. And you figure by now, they should be better. What would their symptoms be that you'd be like, uh-oh?
Well, this is where it gets tricky.
Oh, boy. I knew
it wasn't going to be.
I knew that was coming.
It's really going to be, it's going to be tough because the symptoms of MCAS, or mast cell activation syndrome, MCAS for short, overlap Lyme, Babesia, Bartonella. And so sometimes it's very difficult. For instance, I'll give you an example. My Babesia patients often complain of sweats, right? Night sweats, day sweats, right? It's classic. Well, guess what mast cell patients complain of as well? Sweats, or intolerance, heat intolerance, or they're cold and then they're hot, right? So I'm looking at this patient then, right? And I'm thinking, is it Babesia or is it MCAS? Or is it both? And I think one of the things that helps me understand this is that the symptoms of Babesia, the symptoms of Lyme and these other infections are probably driven by the mast cell.
Oh.
Okay. So I think this is an important point. Now, have we proven this? No, not yet. But clinically it makes sense, because if I think about Babesia, and I think about where the Babesia lives and how it can invade, it lives first in the red blood cells, right? But then it can invade the organs, right? And guess where the mast cells are? They're in the organs. And so I imagine that those infections are setting off the mast cells in those places. We know that they can. And I think some of the symptomatology is coming out that way. So if I have somebody on a regimen, and I think I'm treating an infection, but I'm not getting anywhere, I'm going to go back to the basics. I'm going to go back. What did we miss? Is it possible that mast cell activation syndrome is a bigger piece than we thought? And what if we now add treatment for that and either continue Babesia treatment or discontinue and see how you do on the mast cell treatment? And a lot of it is a little bit of a dance. It's really, the point is that there's no one symptom that I can say that explains MCAS completely, or Lyme or Babesia or anything else. Like really, this is a multi-system disorder. So it can affect all the different organs. So can Lyme and all the co-infections. So any symptom in any organ could represent MCAS potentially. And so I really believe, and I think this is like the strongest point I'm going to make this whole this podcast, is that every Lyme patient, if you diagnose Lyme disease in somebody where it's not an acute Lyme, I'm not talking about bullseye rash, I'm talking about somebody who's coming in, who's been chronically ill for a prolonged period of time, they should be worked up for MCAS, because it's going to be there very often. Listen, nothing's 100%, okay? Because I have plenty of patients who don't have MCAS, but a lot of them, majority, will have it. And it will be easier to treat because you're going to be one step ahead, okay? The worst thing I see are the patients who come to me, they've been diagnosed with a tick-borne illness. This doctor tried antibiotics. This doctor tried herbals, right? They've tried all these things. They are at their wits' end. They feel miserable. They're getting worse because their mast cells are reacting to everything that they've taken. And then you're at square one, and maybe behind, maybe -1. So you have to then start. You got to build the base of their immune system. Okay, and this has always been my focus, even before I knew about MCAS. You got to build the immune system, stabilize the immune system, so that the things that you do to kill will work. And so that's how I think
How is it that you start with the immune system and, trying to almost reprogram it? And, are you doing it herbally again? Are you doing it nutritionally? Are you doing like all the pillars in terms of sleep and stress? What's your choice?
all of them. I mean,
okay. I didn't mean to answer the question myself. I just was kind of putting it out there for you.
No, it's good. No, okay. So first and foremost, and this will work for a subset of people, but certainly doesn't help everybody. But I do think that lifestyle, stress management, sleep, and diet play an integral role. Okay, it's impossible to separate what's going on inside from what they're dealing with that's going into their body, either energetically from the stress or food into their GI tract. But this is the hardest piece, because if these patients already have come to me and they are very sensitive to food, it's not like they have a lot of choice in what they can eat. So it is challenging, but I like to think that there's some foundational work that can be started. It's not going to be perfect. You're not going to eliminate all their stress, but you're going to teach them some coping mechanisms, hopefully, that they deal with it better, okay? And they sleep a little better, or whatever it is. So now you've set that stage. And then, yeah, I use a lot of nutritional support, supplements, herbs. It really depends. And at the end of the day, medications work. So sometimes they need, not sometimes, most times they'll need, from the mast cell perspective, a drug to calm the mast cell down, or to block histamine, or to do something so that the rest of the work that we're doing with diet and other will work, right? It's sort of, I don't have a preference, because what I do is really personalized. So it's every single patient is different. And I've never found two patients who are alike. Have you?
Right. No, they can't be, because, they just, their journey is usually completely different, whether it comes from, the way they were born, to the way they were brought up, to the lifestyle they've understood as the way most people are, regardless of the fact that it might be terribly unhealthy, or, their support, their network. I think people really need that strong foundation, that support, and that network to really make a difference. I bet you, if you went out to your waiting room and two of your patients who were kind of similar in terms of what they're dealing with, if they start talking and they develop a friendship, well, those two are going to probably get better faster than somebody that came in an hour earlier and sat in the waiting room by themselves, right?
True. So true.
So, yeah, I mean, are you talking about antihistamines? Are you talking about over-the-counter antihistamines? What are you talking about in terms of calming the histamine response?
Okay, again, so the step one in treating mast cell activation syndrome is eliminating triggers.
Mm-hmm.
So again, if there's mold in your environment, it's going to be very difficult to do anything that's going to work, right? So you've got to get rid of those things, right? If you're eating something, some patients with this problem are sensitive to histamine foods, or foods with salicylates, or foods with these different compounds. And so, but sometimes they're not. So you've got to identify things that could be triggering and making them worse. That's first step. Then the second step is then finding a regimen that's going to work. And so sometimes my step one there is an antihistamine, Claritin, or loratadine, which is the generic, or Zyrtec, Zyzal, Allegra, over the counter, or the different formulations of them. That's easy. For some people, they feel comfortable with that. Some patients know that they don't like how they feel on antihistamines. So then we go to the next step. Okay, well, if the antihistamines don't make you feel good, or we can't find one that works, are there natural antihistamines like quercetin, vitamin C, things like that we could try? And we just, again, work our way. There's a drug over the counter. It's an H2 blocker, Pepcid AC, famotidine. Zantac was on the market. It was taken off. A lot of people are scared of these drugs. And I will admit, a few years back, I would try to avoid that because I was so worried about the gut and the stomach acid. But let me tell you, it probably doesn't do that much for the stomach acid because it's not as strong as some of the other drugs on the market called PPIs, proton pump inhibitors. But let me tell you, sometimes that just shuts down the mast cells in the gut, or sometimes with an antihistamine together, because they both block histamine, you can get a really great effect. So that's like sort of the simple stuff. And it's simple. For some, it literally is the switch for them. And for others, it's either not going to work or it's a drop in the bucket, and you keep moving on. I think the hopeful thing is that there usually is an answer. There is a solution, but it can take time to get there.
Yeah, it's unfortunate that, people don't wear a letter like on their forehead that kind of tells you which direction to go in, because again, you could be the messenger, and people love to shoot the messenger, and they're like, I'm disappointed. I thought, and they get upset. And I think in terms of explaining things to patients, you got to set the tone right in the beginning. We're going to try this, but I do have other options if this doesn't work, because everyone is different. Do you find that to be true?
Absolutely.
Yeah, yeah, because yet I tell you, especially when people don't feel well and they've not felt well for a long time and they haven't gotten the answers, that the amount of stress and depression is huge, especially they've lost friends, they've lost family, they've just something's wrong with you. You need a, what do they tell most Lyme patients? You need to go see a shrink. You need to get on meds because you're crazy. Well, I'm crazy because I'm so sick.
Exactly.
It's
Exactly.
tough.
Yeah, no, it's
it,
hard.
it's it's crazy. you know This seems to be very debilitating, especially when it comes to triggers that don't allow you much flexibility in either what you do, what you eat. I mean, do you kind of process of elimination? Do you start with diet and say, okay, let's eliminate all of these things that I know, absolutely no leftover food, that kind of stuff. I don't want you to have, certain strains of probiotics, things like that that can trigger histamine.
Yeah, again, where you start really depends on the patient. So, sometimes we need to calm things down quickly, and the diet is going to be something that's going to take time, right? It's not always an easy solution, as you know, for various reasons, right? So often we're doing different things at the same time, but not doing too many things at the same time that it gets confusing. But it may be that the lab work shows sensitivity to gluten. You know, let's say a patient carries the celiac gene. They don't have celiac, but they carry the gene that makes them susceptible. Well, I know that gluten is going to be a no-no for them, although I would argue that gluten isn't good for anybody. But for the sake of this conversation, I would say that they we find that we have definitive proof that they are not able to digest gluten down. And if they continue to have gluten, they're going to stimulate the immune system inappropriately, which can lead down this path of autoimmunity and mast cell activation syndrome. So I'll say, okay, let's start with just this. I mean, it's not so simple to go gluten free. Having said that, there are a lot of options now, more options than even 5 years ago or 3 years ago. And
Absolutely,
so it can be,
absolutely. And
let's
they're
do that.
good.
Yeah,
Yeah, there's
right.
real good stuff out there.
So, I might start there. Or it might be that the patient's already doing a lot of good stuff, but they're eating food that they don't feel they're reacting to necessarily. They eat it, they don't get a rash or something that looks obvious. But we think over time that maybe that food is causing some inflammation in a kind of a low level way. So there are some obvious foods that I might say, you know what, for them, if that's in their diet, I might say, all right, let's pull back one or two of those. And then while we work on everything else, our goal really is to make sure that their diet can become more varied and that they are less sensitive to their environment. That's our goal, because the reality is that there's a lot of stuff in our environment that is not going away. So we need to figure out how our immune systems can work better. And obviously, we've got to figure out what we're going to do about our environment. But that's, I
I know.
guess, a
The
conversation.
environment is tough because you ask the questions. Have you ever had any water damage? Has there been a leak? How old is your house? Those kind of things. What
Right?
about your work? I think people forget about their work,
Yeah.
because a lot of people work in older buildings, and they could have been upgraded or whatnot, but who knows what they covered in those walls or in those ceilings. So, in the old schools, think about the schools. I remember one of my daughters awfully sick until the school actually got torn down and rebuilt. And you know what? Think about the buckets in the hallway. I'm sure there was a mold issue that caused her chronic sinusitis. And I didn't know any better back then, but again, it's that whole reactivation of what that's doing to your body in the sinuses.
That's right.
What's the relationship as to why a lot of people with tick-borne illnesses are the perfect setup for mast cell activation syndrome?
So yeah, it's a good question. Again, I think it has to do with the genetics of the person. So there's a genetic and environmental interplay, right? So the way I think about it is this: there are people who have been bitten by ticks, bitten by fleas, bitten by all these different insects or different vectors, have been exposed, right? They probably even had the full infection, Lyme disease, Bartonella, you name it, right? If I go outside and I pull, 100 people in here and I run an IGeneX test on them, extensive Lyme and co-infection test, my guess is that I'm going to find quite a number, particularly right where I am in this part of New York, part of the country. So, but a lot of them are not sick, right? Some of them are fine. Some of them have a little bit of something here and there. It doesn't bother them, right? But there's a subset of people who are sick. They get these infections and they go downhill quickly or over time, right?
Yeah.
So again, I think that it has to do more about the host, I call us the host, than it is about the guest, the
Yeah,
bug.
yes.
Yes, okay.
Yes, that you wish never came.
Totally. Yeah, leave the party now. You know, um, and, and the more guests there are, the worse the situation is because the host can't deal with all that. The mast cells can't deal. The other parts of the immune system can't deal. And so clearly the people who have multiple infections are going to be worse off. But I really think that a lot of it has to do with the person's immune system to start with. What I worry about the most is our kids and then our kids, because for the future, because every generation is seeing more toxins. Every generation is, and I use the term genetics, but I even would say some of it is genetic, passed down from generation to generation. And some of this is epigenetic, meaning that we actually don't have a gene for mast cell activation syndrome, but we may have multiple genes that could do something if they're turned on by mold, by Lyme, by whatever else. And so again, I think the reason some people get really sick is because of this interplay. Does that make sense?
It does. It does. It sounds like it's the perfect storm. That
Totally.
term
Yeah.
is overused sometimes, but I think in this case, this is exactly what we're talking about. It's just like exactly. Now, can mast cell associated, issues turn or stimulate autoimmunity?
That's an excellent question.
Oh, good. I went from that's a good question to that's an excellent question.
That's
So
excellent.
I'm moving up. I'm moving up.
Look, all your questions are great, are
Okay.
excellent. They're excellent. But this is the reason I say it that way is because some of this is a little bit unclear, but the research is starting to become more obvious on this. And I think that there are actually, the answer is there are two things that could happen. So mast cells can, over time, lead to stimulation of this other part of the immune system that makes antibodies. The other cells, the lymphocytes, right, that make antibodies, they can stimulate, they can send a message, hey, we need some help here, I'm trying to fight something. And they make the antibodies, and then the immune system gets confused and starts to attack itself. So that's autoimmunity. So these are antibodies that should have been directed against something else that turns around and gets directed at us, right? I think about Hashimoto's, for instance, which is a thyroid condition, right? Autoimmune thyroid condition. So the body was trying to fight something else. I've seen viruses trigger Hashimoto's, right? Body sees virus, then body doesn't see virus. Maybe virus is in the thyroid, maybe the virus has proteins that look like the thyroid. Next thing you know, antibody attack. So the mast cells are talking to the rest of the immune system. So they can certainly lead down that path of autoimmunity. But the other thing that I think is really interesting and is underappreciated is that mast cells, when they talk to these other cells and they tell them to make antibodies, could send a faulty message, and they can stimulate what I'll call false antibodies, meaning that these antibodies are actually not doing anything. They're not attacking an organ, they're not attacking the body. They're circulating and they're totally inappropriate, and but they're not directed against the thing that it looks like it's directed against. And I see this quite often in mast cell activation syndrome patients. They have what looks like an autoimmune flare to their condition, and yet they do not have an autoimmune disease. And in those cases, some of those cases, I think that the antibodies that we're seeing when we test, like a ANA is positive, or a rheumatoid factor is positive, or something else is positive, maybe it's negative another time. These are patients that could, I'm not saying this is the case all the time, but those are patients that really could have the mast cell, the MCAS, as the root of what looks like autoimmunity, but is not. So it's kind of a complicated way of looking at it.
Yeah, that's almost something that's almost impossible to tease out. I mean, you have to kind of, talk about low-hanging fruit. You've got to try one thing at a time, because again, and I'm a big believer, I used to have patients come in when I practiced gynecology. I want my birth control pill, I want my Zoloft, and I want some Anaprox for the cramps. And it's like, I mean, people are caught in that. You got to treat everything. You've got to give me something for this. And the time, it takes time. This is definitely not a one and done kind of deal.
No, it's not. And that is very frustrating. It's frustrating for the practitioner because my life's work is healing people, right? And if I can't heal someone the first time, right, that's hard. I just want to be able to just solve the problem quickly. It's hard for the patients, right? This has been a long road. They've seen 50 practitioners before they've walked in the door, or 20 or whatever it is, right? They have a stack of charts. And you've got to sort of peel the onion away, because there are going to be many layers. I want to be clear, and at least in my patient population, MCAS could be this really important piece. It could be the piece, but it could be also associated with these other things, right? And so it's about that balance. Okay, what am I going after next? What's driving what? And like you peel the layers away of that onion until you get to what the real problem is. And that does take time.
Right.
That could take a year, it could take 2 years, it could take,
Yeah, it does. It can. How big of a role does the gut play in mast cell activation syndrome?
Huge. So number one, I don't know, in the functional medicine world, we talk a lot about the immune system, the bulk of our immune system being in the gut. And that's true. We do have a lot of cells, immune cells in the gut, and we have an abundance of mast cells in the gut. I think about it evolutionarily, right? So those mast cells are probably there because from the beginning of time, we were eating food that couldn't be heated or whatever, right? Eating off the ground. We're I'm thinking about like caveman days, right?
Yeah, because I didn't eat like that. If you ate like that, we need to talk. Oh, girl, you got some problems.
No, not us. I'm talking about like 10,000 years ago, 20,000 years ago.
Okay. Glad we're clear. We're clear.
Yeah, let me.
I thought you were going into the soil-based probiotic kind of,
No, I'm not even going to touch that.
Okay,
Yeah.
go ahead.
But no, even like a million years, I'm thinking about our evolution, like our genetics hasn't changed that much in 20,000, 30,000 years. So we're talking way, way back, right? So we would get exposed to parasites. We'd eat something with bacteria. So our mast cells are there in our gut, ready to fight, right? So it makes sense to me that the respiratory tract, the GI tract, and the skin are like probably the bulk of where the mast cells are, because those are all interfaces with the environment. And so, so those mast cells are in the gut. And we have data, we have studies that have looked at the microbiome, the natural bacteria and microbes that are supposed to be living in the gut, and how they interact with mast cells, and how that might be something that starts the vicious cycle of mast cell activation syndrome, right? You don't have the right flora. Could be your diet, could be going back to childhood, you were formula fed. It could be something else, right? Over time, we're on antibiotics for the recurrent sinus infections that no one knew were due to mold, right? And so next thing you know, you wind up with these bad bugs. Those bad bugs tell the mast cells, come on, go. And then you wind up with inflammation. And that inflammation can show up as reflux, right? So some patients just have horrible heartburn, etc. For some patients, they have the lower intestinal tract involved, right? It could even be colitis, different, inflammatory bowel disease. It could be irritable bowel, could be all these other conditions, right, that affect the GI tract, gallbladder, all these different parts. But the root is this dysbiosis, abnormal gut flora, interplaying with the mast cell.
Yeah, you really have to have quite the foundation. I look at, I'll be driving or whatever, and I look at all of these landscapers and they're thigh deep in tall grass. And I'm like, why hasn't Lyme disease taken out every landscaper in the Northeast? I, I don't, I'm amazed, I don't even know the tick that bit me. I never even saw it. I wasn't doing anything high risk. I guess having dogs, that makes, steps it up a little bit, because they can bring those critters in the house. But it's quite amazing that some people either don't get sick or don't get that sick, or that they're more resilient. Do you find, a category of people or age group that seem to be more resilient, or something about that person that seems to be more, allow them to be more resilient?
Yeah, I think this is what I was getting at, that I think that there is a genetic component. It's always not predictable. So there's a genetic component, and there's an environmental interplay. And I think a lot of that starts young. Now, so it doesn't mean that there are particular ages that people are more vulnerable, but I'll make a point about that in a second. But I think that there's, again, some predisposition that they might have, that then getting Lyme or mold exposure or both or whatever, right, is then just going to take them down, right? So I've taken care of landscapers, and I have patients who are, in the grass all the time, and some of them have had Lyme disease. I had one who had Lyme disease probably 6 or 7 times, like true Lyme disease, acute Lyme disease, over almost every year, with the bullseye rash, right? Now, yeah, he has some chronic issues, some arthritis and some joint stuff, but surprisingly does really well after a course of antibiotics. And I usually give them a nice hefty dose, so I want them to be done with it, and then they move on. And so, how is that possible? If you had Lyme disease 6 times acutely, right? Most people wouldn't be able to withstand it. So I do think that there's something genetically that their immune system is able to handle. Now, one of the things I think is, I want to mention age for a second, because I don't think Lyme or any of those has anything to do with age. So I have a 65-year-old woman who got Lyme disease 5 years ago, probably. I have young kids with Lyme disease, right? So you can get Lyme disease at any age. But I think what's really interesting to me is that there are particular times in their life where they seem to be maybe more vulnerable, particularly in women, but also in boys or men, the changes in hormones at certain times. So it's puberty, it's that childbearing age, and then there's menopause, where their immune system shifts that might make them a little more vulnerable. And is it vulnerable to the infection, or is it really the host that's having the problem? And we know that mast cells are very affected by hormone regulation, which I'll explain because I think it's very interesting. They can read the fluctuations in estrogen and progesterone and all that. And so if that perfect storm happens at puberty or before puberty, so girl gets a tick bite, they didn't know, hormones are starting to shift, she's starting to not feel well, but she probably had some history early on that was suggestive of a mast cell issue, boom. And then you get a whole host of other things that can develop. So mast cells. So one thing I wanna mention, I think is important. Mast cells have these little antennas on their surface, right? That's how I call them antennas. They're basically scanning the environment. Okay, they have these antennas that serve in the allergy perspective. They're called IgE receptors. But they also have antennas, receptors for estrogen, progesterone, testosterone. So I see a lot of women, they have their worst symptoms are right before the period, like a week before, right? That PMS that we always talk about, premenstrual syndrome. They're anxious, they're craving, they're miserable, and all their symptoms are worse. All their Lyme symptoms are worse. And I do this because I don't think it's their Lyme that's worse. I think that it's their mast cells that are worse, because the mast cells are getting this read of like, oh my God, there's a lot of hormone. And then, oh my God, there's no hormone, right? And then you have to bleed, right? And that shifting is enough to make them flare.
Wow.
So
Wow.
I don't know if you've noticed that in your patients or with you in the Lyme world, that there can be this fluctuation around the periods for women.
Well, I'm going to have to look at that. That's a good question. So I'll get back to you on that one.
Good. Good.
What about men? I mean, men
Yeah.
typically, unless you're talking about puberty, and we know that there's a steady decline of testosterone over the after 30 or 40. I'm not sure what the age time frame is, but I mean that's a constant change. Are men more susceptible at certain times outside of puberty?
Yeah, I mean, I think that, there is this concept of male menopause, right? That's it's a little bit vaguer. It's not as clear as women, but yes, I would say they can be just as vulnerable during that time, definitely during puberty. And then there are these other things. So they may not just be hormonal; they're just stressors in your life, right? There's certain big things that happen through your life. You get married, you have a child, like all those things. So for the woman having a child, that's one thing, but for, let's say, a partner who's a male who's dealing with that, right? That's a whole host of other things. So I just look at it as these triggers, whether they're internal or external, are really part of the key to why this is getting bad in some patients, why it continues to get bad.
Right. That whole trauma thing. You ask somebody, when did all this kind of start for you? And they'll sit back and they'll think, and you say, everything was fine until, and that until may very well be a significant trauma. I was fine until, I lost my mom suddenly, or everything was great until had that terrible car accident and I was in the hospital for 2 months, or you know um
Yeah.
oh gosh, name it, anything significant, a death, a divorce, a loss of a job, things of that nature
Yeah.
really do play a big part of how our health is.
Yeah. No doubt.
Yeah.
And those with trauma are probably at the highest risk for MCAS or persistent MCAS. And dealing with the trauma, which is much more easily said than done, is the key to getting better overall, right? Not just from MCAS, from everything, right?
Right, right. You know, it was funny because I listened to a segment on helping people deal with vagal tone and trying to, and, you know, it's funny because I knew that, you know, in help of your immune system, you can actually get yourself in a hot shower and then make it cold and then make it hot and then make it cold. And, you know, that you really help your mitochondria if you get cold, etc. And, you know, it talked a bit about stimulating the vagus nerve, especially if you're anxious. You know, they say splash some cold water on your face and it's going to, well, it's going to put you in a shock, for goodness sakes. Of course, you're going to calm down because you're going to be in shock. But, you know, learning how to teach people how to breathe and how to just be mindful and try to just stay in that moment for a little while. The other thing that was interesting is to switch your body from that fight or flight to that rest and digest. One of the ways, outside of, you know, freezing yourself in the shower, is to hum. And I
Yeah.
was like, wow. But you think about it, if you're really concentrating on something other than, oh, I'm so miserable and, "Ugh," you know, that kind of stuff, and you're humming, you actually do calm yourself down. So, you know, for anybody that's listening and wondering, and I hear you humming around, if I hear anybody humming, I'm going to think you're a listener,
Exactly. Exactly.
which is good, which is good. We
I
can,
love that advice. I think that's great. And the other thing that can be very helpful is, so concentrating on the vagal nerve is one way to do it. The other way to do it is to work on the limbic system, which is the part of the brain that is responsible for emotion and things like that, and stress. And it interacts with the vagal nerve for sure. And there are various programs out there now that can be done at home where, but these are a little more methodical than just meditating. Because I tell patients all the time, I want you to learn how to meditate. And they say, well, I meditate, but still don't feel well. And it's because meditation alone might not be enough to get to the real root in the limbic system, which is often triggered by traumas. And you really have to dig deep. And so there are a few programs out there. One is called DNRS, Dynamic Neural Retraining System. I don't know if you've heard of it. The other one is the Gupta program. So these are different ways these are things that I recommend to my patients, and particularly if they don't like to meditate or they're not getting the results that they need, because it's very structured. It's a program you've got to commit yourself to. It keeps people accountable.
I'm going to get my paper out. I can't reach my pen. So as soon as we end,
I'll send it to you.
yeah, as soon as well, as soon as I finish with the recording, I'm going to be getting my paper, and my pen's way over there. This has been very, very, kind of eye-opening. You know, it's funny because I have a daughter who is an infusion nurse at Dana-Farber, and she deals with this mast cell activation in terms of blood and chemo and whatnot, and they're right on it when it comes to having some sort of a rash or, you know, hives or whatever, and right away it is the Benadryl and the Pepcid, and it's quite interesting. And she talks a bit about, if it's skin, that's one thing, but if you get into, all of a sudden you're up and you're running to the bathroom because you're going to have diarrhea, that's a two system problem, and how serious it is. And I guess we, you know, even for me that has a knowledge, it didn't seem like, oh, you know, I know that, you know, giving blood and having blood reactions, that's serious. But it's interesting because of this interplay with so much of your body with mast cells.
Correct. So you're right. I think that people who are used to reactions are a little bit more on alert to this. But even having said that, they're not always. But I think it's really important to understand that, yes, some reactions, if it's in the GI tract, if it's in the respiratory tract, if it's in the skin, we're sort of used to that as allergic-like phenomena. But take a patient, for instance, whose main issue is activation of mast cells in their nervous system, right? This is something we don't think about. So, you know, I just talked about the limbic system. I just talked about we talked about the vagal nerve. Well, every nerve in the body is surrounded by mast cells. And so guess what the mast cells do with the nerves? They talk to each other, right? So mast cells have neurotransmitters that they release, and the nerve sees that and talks back to the mast cell. So then you think about inflammation in the nerves. So what things can happen when you have inflammation in the nerve? Well, you could get depressed, and that could be your mast cell symptom. Anxiety, OCD. I've seen PANDAS or PANS, pediatric, sort of like autoimmune encephalopathy, present as a mast cell issue. Neuropathies, small fiber neuropathy, large fiber neuropathy, all these various things. And so, you know what, I think, again, my job is to really educate as many people as possible to understand that if they don't have allergic reactions, that doesn't mean they don't have this, because you don't have to have an allergic reaction, but you have to identify if mast cells are what the root of the problem is in a different part of the body.
Yeah,
So that's, you know,
that's incredible, because you wouldn't think of nerves as being, you know, surrounded by mast cells. These little buggers are everywhere.
they're everywhere, and they're protecting us. I mean, you don't want an infection in your brain, so I can understand why the mast cell is there. And quite honestly, you have other immune cells in the brain that also are there to protect. And it's when the signaling starts to become discombobulated and you start, you know, sending the wrong signals, that you get inflammation. And as soon as you get inflammation, you get this release of these chemicals that are not supposed to be there. That inflammation then can cause, you know, again, like, you know, an array of symptoms, very, very long. So I think that, and so the take-home message from my perspective is that if there's any suspicion that there's something going on with the immune system, you know, take a look further, try to get some answers, try to talk to your practitioner or whatever, to whoever's taking care of you, to try to look at it, because you don't need allergy, right? I have so many patients who come to me and say, everyone thinks I'm crazy because I don't have an allergic symptom, so how could I have this? Again, you don't need it. So I just would like that to be like the important take home.
I think that's top, you know, and sometimes it does take the patient to educate the practitioner, you know, and that's okay. And if your
That's what
practitioner
I'm saying.
doesn't like that you're trying to educate them, then maybe that's not the right practitioner for you.
It is tough, right? I'm finding it, I don't know if it's more difficult lately or just because I don't know. I can blame it on COVID. I can blame it on a lot of things, but um, yeah, I'm seeing that resistance for a lot of doctors. I think that everyone's overwhelmed right now, you know. So they always were, but now it's maybe a little more. And so we are getting a little bit of pushback, more pushback from doctors who don't want patients to lead their care. You know, going back to the sort of old-fashioned paternalistic, "Don't worry, I'm your doctor," is kind of where things are going, and that's really unfortunate because I love when my patients tell me what they want or what they think is going on. They know their body better than I do, and so I encourage that. But unfortunately, I know that they're not always listened to. Patients are not always listened to by others.
Right, right. Well, again, this has been amazing. I learned a lot, and I'm sure everybody who's listening learned a lot. And we'll have to do this again, because I think we're a good pair here.
I think so too. Yeah, I agree.
Did good. I think we did good. So you hold on there. Don't go anywhere.
Got it.
For all you guys who have listened, this was Dr. Tania Dempsey, and she's in New York, and you can get most of her information off the website underneath her bio. Until next time, everybody, stay well, stay healthy, wash your hands, wear your mask, and be good. Bye now.